Have you ever wondered about the potential threats that an unknown disease could pose to our health? Let's take a moment to delve into the concept of Disease X. The World Health Organization defines Disease X as a potential international epidemic caused by a yet unknown pathogen. It's a scenario that deserves our full attention and preparedness. While Disease X might sound hypothetical, it is a very real concern that has parallels in our recent history. The concept of Disease X isn't purely theoretical. History has shown us that unexpected outbreaks can and do happen. Take, for instance, the COVID-19 pandemic, a surprise that caught us off guard, or the Ebola outbreak in 2014, which served as a stark reminder of our vulnerability. Each of these instances highlighted our collective need for better preparedness. So, an unexpected disease outbreak is not just a possibility, it's a reality we have already experienced. So, how do we prepare for the unknown? How do we prepare for Disease X? Firstly, we need to focus on controlling bioterrorism. International guidelines need to be developed and enforced to prevent the intentional misuse of pathogenic agents. The risk is real, and the potential fallout is too dangerous to ignore. Secondly, we need to seek advice from academics without political interference. Their expertise can guide us in making informed decisions, particularly when dealing with a pathogen that we know little about. Thirdly, implementing travel restrictions is another critical strategy. Quick and appropriate travel restrictions, along with thorough airport screening, can help contain the spread of the pathogen X across borders. Next, we need to encourage collaborative efforts among the world's scientists, clinicians, and infectious disease experts. Their collective knowledge and coordinated efforts are vital to investigate, control, and eventually eliminate Disease X. Widespread testing and aggressive contact tracing are also crucial. These measures can effectively contain the outbreak, enabling us to isolate cases and prevent further spread. Investing in medical countermeasures is another significant step. We need to accelerate the development, availability, and approval of diagnostics, vaccines, and clinical trials. Timely investments can make a difference in our fight against Disease X. Active surveillance of virus laboratories is also needed to avoid potential leaks of new viruses. Laboratories globally should follow stringent safety measures to prevent accidental release of pathogens. Moreover, we can adopt a One Health approach. This strategy bridges institutional gaps, defines priority risk areas and pathogens, and addresses risk factors for emerging and re-emerging infectious diseases. It's a comprehensive approach that considers the interconnectedness of human, animal, and environmental health. In conclusion, preparing for Disease X involves a combination of strategies. It requires global cooperation, scientific collaboration, swift action, and proactive measures. It's a challenging task, but not an impossible one. By implementing these strategies and working together globally, we can reduce the impact of Disease X and protect public health. Now that we've discussed the preparatory measures, let's talk about the next step: taking action against Disease X. This is where our collective efforts come into play. It's not enough to just prepare. We must actively fight the spread of this disease. This involves supporting health agencies worldwide, both financially and logistically. Donations, volunteering, spreading awareness, these are all ways we can help. We also need to follow the guidelines set by health organizations and governments. This means practicing good hygiene, maintaining social distancing, and getting vaccinated when vaccines become available. We must trust and support the scientists and healthcare workers who are on the front lines of this battle. Their tireless efforts are crucial in controlling the outbreak and saving lives. We also need to combat misinformation. It's essential to rely on credible sources for updates and information about Disease X. Misinformation can lead to panic, stigma, and discrimination, which can further exacerbate the situation. Lastly, we need to take care of our mental health during these challenging times. It's normal to feel stressed or anxious, but remember, it's okay to seek help. Let's stand together in this fight against Disease X. Your actions can make a difference. Remember, we're not just protecting ourselves, we're protecting our community, our loved ones, and our future. Thank you for watching today's video. If you found this information valuable, please like, share and subscribe to our channel for more insightful content on global health and preparedness. Together we can make the world a safer place for everyone. Stay informed, stay safe and stay healthy.